We all depend on our eyes to help us drive safely to our destination, work at our occupations, have fun in our hobbies and with our families, and absorb information that is vital to our everyday existence. When we are young, many of us can see everything clearly, from very near objects to faraway objects. But over 50% of people over the age of 60, and quite a few younger than that, have the quality of their vision affected by a progressive eye disease called cataracts. In fact, cataracts are so common, it is said that nearly everyone will develop a cataract if they live long enough. Surgery to remove cataracts is a safe and commonly performed medical procedure. Worldwide, it is estimated that over 14 million lens implant procedures are performed each year. Today, when patients are diagnosed with cataracts, many doctors agree that the time to have them treated is when their quality of vision begins to interfere with doing the things they like to do most in life. And now, thanks to recent breakthroughs in lens implant technology, patients can not only resume doing the things they enjoy most in life, they now have the possibility of seeing like they did when they were much younger. Today, patients are choosing to have their vision restored with presbyopia-correcting lens implants, designed to provide excellent distance, intermediate and near vision, with little, if any, dependence on glasses or bifocals. In a young normal eye, light from both distant and near objects enter the cornea, pass through the clear natural lens, and comes to a point of focus on the retina, providing us with a full range of clear vision. But as we age, beginning around the age of 40, the natural lens inside the eye begins to harden and lose its flexibility. This reduces the eye's ability to change its focus from near to intermediate to distance and back again. This is known as loss of accommodation or presbyopia, and its earliest symptom is difficulty seeing things up close. Bifocal and even trifocal glasses become necessary for some people to see clearly at all distances. As the natural lens of the eye continues to age, it starts to become cloudy or brown in color. Vision becomes blurry and colors lose their brilliance. This is called a cataract. At first, frequent changes in glasses prescriptions can help, but left untreated, cataracts could eventually lead to blindness. The only way to see clearly after cataracts mature is to have them removed and then replaced with intraocular lens implants, which were first used over 50 years ago to restore vision. Until recently, patients undergoing lens implant surgery received monofocal implants that have only one focal distance. Having monofocal lens implants in both eyes generally provides good distance vision, but patients often need bifocal or trifocal glasses for near and intermediate vision. Today, many patients are choosing to have one of the presbyopia-correcting IOLs that can provide a full range of vision, so they're less likely to need glasses or contact lenses for most activities after cataract surgery. For most patients, this translates to greater visual freedom to enjoy daily activities such as golfing, working at the computer, or reading a book, with little, if any, dependence on glasses or contact lenses. Surgery is performed on an outpatient basis and typically takes only 15 to 30 minutes. Because the eye is completely numbed with topical or local anesthesia, the procedure is virtually painless. The surgery involves making a tiny incision on the edge of the cornea and gently breaking up and removing the natural lens. Once it is removed, the presbyopia-correcting IOL is then positioned in the same space the natural lens occupied. You will be allowed to go home soon afterward where you can relax and enjoy the rest of the day. Most people can resume their normal activities in a day or so. Everyone heals at a different rate, but in most cases, vision is improved within 24 hours and continues to improve as your eye heals and you become more accustomed to using your multifocal lens. A visual side effect most people experience is halos or glare around lights, especially at night. The visual characteristics of these side effects depends on the optical design of the IOL and varies in intensity from patient to patient. For most people, these side effects are more noticeable during the first few months, but tend to diminish over time and should not impair their ability to visually function at night. Most patients report that the ability to see near, intermediate, and distance far outweighs any visual side effects they may experience. Although you might prefer to use glasses for prolonged reading, to read very small type, or to drive at night, most people report they can go to the store or conduct most of their daily activities without depending on glasses. The full benefit of having presbyopia-correcting lens implants will be even more noticeable when both eyes have been treated, because you will have binocular vision at all distances. Once it is determined that you are a good candidate for a presbyopia-correcting lens, you will be given additional information about the possible risks, complications, and costs involved with the procedure. Be sure to have all of your questions answered before giving your consent to have surgery. Although the thought of having any kind of eye surgery can be a bit frightening, it's good to know that such a tremendously successful medical procedure has just taken a giant step forward by providing even greater benefits. The prospect of life with reduced dependence on bifocals and glasses.